Hey everybody, thanks so much for joining. Hey,
Hey, Megan, how
how-
are you?
I am well. How are you?
I am doing great. I am doing great. Thank you.
I love that I'm seeing you like what, twice in like 5 days.
It's
This is such a
Spice and
treat.
Pie. It's definitely Groundhog's Day, so it's good. It's a
Are
good.
you back in Chicago?
I am, and I had a very full clinic, and I'm glad everything flowed just right so that I could sneak away and save the best for last.
Well, we so appreciate you making the time. And to everybody joining us at home, we're so excited to have you. My name is Meg Storm, and I oversee content here at Edit. And I am truly honored. We've been planning this since January. So to tell you that I'm excited about this would be an understatement. But I'm honored to be joined tonight by Dr. Julius Few. I don't really feel like you need an introduction, but for anyone who doesn't know Dr. Few, he's a board certified plastic and reconstructive surgeon and the founder of the Few Institute, which is based in Chicago and has an outpost in LA as well. He's also an Edit advisory board member, which we're very grateful to have him and his expertise there. Dr. Few really is one of the pioneers of kind of combining, or I know you like to call it stacking, surgical and non-surgical procedures. And that extends to skincare as well. And you have a fabulous skincare line that we'll talk a little bit about too, called Euphoria Beauty. And so really what we're going to be focusing on tonight is kind of the way Dr. Few marries all of these different modalities together to give patients kind of the most natural and lasting result, and this kind of concept that he has of four-dimensional beauty, which I've always found really interesting, and I love to hear kind of you describe it yourself. So before we kind of dive into everything, Dr. Few, would you mind kind of introducing yourself to everyone?
Well, I am. It's pretty hard to follow the kind introduction you just gave, Meg. I really feel like I've been very fortunate to really become a plastic surgeon at just prior to the inception of non-surgical cosmetic medicine. It was really, it's timing, and timing. It's what I tell my teenagers. Timing is really everything.
Yep.
And, I was fortunate to start in a career that at the time when I started, it was just surgical, and to then be able to contribute and help to carve out a little chunk in the non-surgical world is, it's been a huge honor for me.
And I just feel like that's where I feel like that's where all the excitement and innovation is right now. And I feel like you've always kind of been at the forefront of that, which is what I'm excited to dive into. So to everyone watching, if you have questions, please feel free to drop them in the chat as we go, and I'll keep an eye on it and we'll try to cover all of those. But Dr. Few, to start off, I would really love for you to describe the kind of concept of four-dimensional beauty and what that means to you as a plastic surgeon.
Well, it is the culmination of nearly 23 years in clinical practice, and the last probably 10 of those years have been heavily focused in the entertainment world. And that's a long story, which we don't have enough time to get into how that happened. But nonetheless, being fortunate and blessed to help take care of some of the most famous faces on the planet. Really what that has taught me is really the dramatic nature that in-person kind of encounter has versus a print version.
Yep.
And so one of the things that it just kind of struck me was, how is it that I could see a household name celebrity who in a photograph or in a movie looked a certain way and, by all accounts was attractive and so on. But
Yep.
then when you saw them in person, they went to even a more dramatic and more appealing level. And what I realized was this concept of what you mentioned, four-dimensional beauty, and really what that represents is the concept that we deal with really the three dimensions we all know, length, width, and the distance, that
Right.
three dimensions. The fourth dimension is really time and moments in time. So we're not talking about days, hours, minutes. We're talking about microseconds of movement, and really what is communicated both in terms of verbal and nonverbal communication.
Okay.
And so what I became very aware of is that in cases or people who I met or people who I knew who maybe did a little bit too much filler or a little bit too much, the neuromodulator treatment, that they looked off or odd. And even, a classic example is I went out to lunch one weekend, a Saturday, with my two boys, and a woman came up to us who was not a patient of mine,
Okay.
who clearly had way too much work done. And my kids were practically drooling, looking at this person, trying to figure out what was going on.
Yep.
And so it really was very clear that in a photograph, like if you looked at this person on social media, they look great.
Right.
But in person, their movement was altered, and that really is what four-dimensional beauty represents, is that transition from moment to moment in interpersonal interaction that can either make or break a moment.
And I want to talk about the social media piece, because I feel like we've moved in this direction of everyone wants to look a certain way in a photograph. And how have you kind of tried to marry people's goals there with, okay, but you still want to look like a real person in real life?
Absolutely. Well, and so you touched on really probably the most important thing and the biggest responsibility that any cosmetic plastic surgeon, dermatologist, or provider of any kind really needs to hone in on, is the idea that you really have to look at animation during that in-office kind of visit. And so what we really try to do, and I've started to incorporate more and more videography into that assessment, so I can show people, I can say, look, you have this, this picture, but let's just take a look and look and take in kind of the benefit in your expressivity. And a matter of fact, we just published a study based on our, as you know, the CR emulsion, which is the CBD-based product. But basically, what made that study so revolutionary was we incorporated videography. And so what really came out was the sense of confidence that the given people and that we've been fortunate to take care of present. And I just saw it today. I had a facelift patient of mine come back who literally, her presentation in terms of the aura and just the confidence 7 weeks out from surgery is dramatically different. And it's these intangibles that, and again, not going over the top, it just makes this kind of, in my opinion, really the goal of what we should be trying to do in this work.
Certainly.
Yeah.
And so you talk about a facelift patient. What for you is kind of that sweet spot of someone who's maybe ready for surgery, someone who's not ready for surgery? How did those conversations go for you as you're kind of thinking about this whole concept of movement and maintaining that naturalness?
Yeah, well, and so in general, as somebody who's kind of formed an expertise in both the surgical and non-surgical space, especially for facial rejuvenation and prejuvenation, which I know we'll touch on, is the idea that really it's a continuum. It's not just surgery or non-surgical.
Okay.
I try to position things in a way so that if somebody is not sure which direction they want to go, it's easier to do something that's a bit more temporary, that's non-surgical, that then can lead into a surgical option if that's what they want. Yep. And so for a classic example, and I just had, again, all these discussions today that played into our discussion, is one of the techniques that was developed, I don't know, now 12, 14 years ago, was the so-called Nefertiti neck lift of injecting the botulinum toxin into the neck bands to make the neck smoother and to look more contoured. Well, there's a technique that can make that a more permanent technique that is a bit more surgical that I call a neck band procedure. And that's where I can use a special needle, that's called a no-core needle, to actually go in and break up the bands of the muscle, much like the Xeomin Dysport Botox would do, but it does it in a more permanent way. And so, again, you can marry these concepts, which is what makes it fun, which hopefully that's coming across, that I have a good time doing this. But at the same time, it really, one, on the non-surgical side, can lead to a surgical solution. So somebody kind of gets a tester run. They get tested before they have to go to the more permanent option.
For sure. And I think, does that play into this kind of rejuvenation idea as well, where people might be starting a little younger than they used to? And so it's not always about correction as much as it's, maybe preventing some of those things from needing to happen in the first place?
Absolutely. So I kind of came up with that term prejuvenation at a meeting. I think it was a multi-special. It was, I think, the Vegas multi-special
Okay.
meeting probably 10 or 11 years ago. And really the whole concept came up during a panel, because at that time I was just starting to really kick into taking care of a lot of models and actors and so on. And that group really was keen on the idea of avoiding the knife. Their view was, look, what can I do to stay ahead of this? I don't want to look off because I'm making a living on how I look now. And so I realized that from earlier work that I had done and I had written about was the idea that if I capture an issue like a frown line or an irregularity, like I know that maybe a certain man or woman, it runs in their family that they get jowly very early,
Yeah.
that you can preempt that whole phenomenon just by simply targeting that area when it first starts to form, and then you hold it in suspended animation. And that's the reason why my goal is often not to try to make somebody look obviously like another person, but rather to, especially because everybody is beautiful, I believe, if you try to take that given point where things are transitioning and maybe not the most positive way and hold it, well, then that mission accomplished. You've now made somebody kind of achieve their goal of looking naturally beautiful and aging in the most graceful way, which in my opinion is the way to go. It's not about aging ungracefully or in an artificial way.
Or even not aging at all. I think that seems to maybe be a little bit of a trend as well, of like, it's okay to show some level of age. And I know you're dealing with some Hollywood types where maybe that's a little bit different, but for regular people, I think showing that age gracefully is your point.
I agree. I think one of the most empowering in today's National Women's Day, I mean, which I'm proud to have some of the most amazing women that really make the field.
You have a great team.
I have an amazing team, and I also have an amazing team that helps me out beyond as well, also in Chicago. And, at the end of the day, it really is about allowing for, like you said, some of the components as they come out. There's nothing wrong with it. I have seen some of the most striking women with all gray hair. I mean, just striking. So to me, it's one of these things, and one of the fun things, and where the artistry of in my mind, cosmetic medicine and surgery come through, is in creating subtle contrast. So you have somebody who maybe has gray hair, but at the same time has a youthful kind of very subtle cuteness that then shines through, and it's their own individual expression. That really is the way that it comes across. So
yeah, for sure. And so when it comes to someone coming to you for a consultation and you kind of taking all of these things into consideration, what does kind of the typical consultation process with you look like as you kind of talk someone through what the different types of options are?
Well, the first thing I try to do is to listen, and I ask really which way are they going? Because usually it's either the one of three categories. Either I definitely want surgery, I definitely do not want surgery, regardless of what they need. I definitely don't want to have surgery, or I'm undecided, give me both pictures. And within that subset, you really have, in my opinion, there are three kind of areas, and this is general. But again, when we talk about this stuff, the goal is not to make it complicated so people think you're so smart. It's to boil it down to a way that you can digest it. And in my mind, that is looking at skin. So what's the quality of the skin relative to their goal? What is their volume status? Are they depleted? And is that something that tends to happen in their family? And then the third is sagging. And so when you look at those three components, well, then I get to kind of go into my tool or paint box and then decide what are the options that work for it. And so for the skin, it may be, different forms of resurfacing, laser, peels, etc. And then when you look at lifting, non-surgical versus surgical, and like I said, I've been in the evolution of at the very beginning where the first filler we had was Restylane in that category. And now look at, I mean, we have, more options than you could even hope to use. And so I think that's where it becomes, much like picking the right paintbrush for the component of the canvas you're painting on.
And so what are, on the non-surgical end of things, what are some of the things you're most excited about right now? Or what are people coming in and requesting the most?
Well, I'm really, really, really excited about Soft Wave, which we just brought in late last year.
Yep.
It's been something that, and in reality, an indicator in our practice of what is exciting is how quickly it picks up steam.
Certainly.
And really, if I look at that as an application, it really holds promise. It kind of builds on conceptually what was great, in my mind about Althera, which by the way is still a very good technology that we still use actively in our practice.
Okay.
And we're kind of in the process of figuring out how to complement things. And you asked me earlier about kind of combining different modalities. When I first came up with stackable treatments as a concept, which at the time was thought to be heresy, it was the combination of Althera, lasers, and fillers of sorts.
Okay.
And so doing that all in one setting. And why did I come up with that? And I went through all the clinical research to try to figure that out, was purely out of necessity. That was when I first started seeing patients in New York. And I didn't have the luxury of trying to space it out over, over 6 months. They really needed to get to their point. These were, as we all are, busy people. And then I realized, well, wait a minute, it's not just that I was doing it out of efficiency. There's synergy in it. So when you're targeting and applying heat energy on the surface, heat energy on the undersurface of the dermis, and then you're adding volume expansion, you're supercharging a collagenesis response. You're supercharging the body's ability to repair itself. Yep. So all of a sudden now you've created this powerful synergy.
And back to Soft Wave for a second. What was it, or what are the areas that you're treating the most with Soft Wave?
The areas that are most challenging are the lower face, so the jawline and the neck. And I agree completely with my friend Dr. Weinstein. It is a game changer. And if you look at the big picture of kind of how to put it together, I love to complement it with my thread lifting technique.
Yes. Okay.
And especially for somebody who maybe has a bit more going on in terms of age-related change, but they're still really resistant to surgery. What I've been doing with the help of Shay and Julia, who are in my office, we have been combining this where I'll do thread lifting, get a result, and then we can come back and do Soft Wave to further enhance, and it seems to really play on that matrix that has been created by the thread lifting. I use the silhouette mainly. And then what we can do is if they still have a little bit of jowl fat, especially for those who they inherit it from a mother or father, then I can do a bit of off-label Kybella injection to shrink it down, which is lipolytic therapy. So now all of a sudden we're creating this like multifaceted approach that can deliver a progressive result, and at the same time always bearing in mind four-dimensional beauty, not trying to do anything that just for the sake of a photograph on social media is a result at the expense of them scaring everybody, including small children, when they walk into a restaurant.
Yep. Nope. That would be a good goal, I think, for all of us to keep in mind. I'd be remiss not to ask you a little bit more about thread lifts and for you to just kind of share all of the work you've done in that space and why you think they're so effective for certain patients.
Well, I mean, I think the benefit is in the numbers. And, when you look at, there is no perfect answer. And so I'm not going to try to say it's perfect, but of the things, both surgical and non-surgical that I've done, it has proven to be over time, and it's now more than 6 years, one of the most effective things I've ever been involved with. a little over 6,000 procedures, and looking at results. We studied, we published our results, and at the end of the day, it has been a game changer. It's both been able to, especially with the technique I've been using over the last year, year and a half, it is very robust and powerful to address the lower face and the neck.
Yep.
But also, what it's done is it's actually made my facelift better. And I do a lot of facelifts as well, as you know.
Yeah.
And so what I've learned is a lot more about vector movement relative to four-dimensional beauty and how those all interconnect. So my facelift has gotten better because of all of the thread lifting experience that I've gotten in 6 years. And so they feed on each other. And so my thread lifting technique has gotten better because my facelift technique has gotten, so it's like all these things kind of play into one another. And I'm really looking at it more from an artisan perspective of, you know, this is putting in natural movement pieces. And so, yeah, the thread lifting now, where it is, as you know, FDA, the Instalift is FDA indicated for mid-face or cheek lifting. I would say the vast majority of the work I do is mainly in the lower face.
Okay.
And the sweet spot, based on our published literature, we have the largest published series that looks at results going more than 3 years out. Most of the studies are 6 months, maybe a year. And so basically what we found looking at that protracted follow-up is that the sweet spot is about 2 years.
Okay.
We have some patients, especially when you tend to look at a younger patient, younger means under 40, that it pushes out closer to 3 years, especially if you're doing more of that prejuvenation, or I'm working on a model who wants to address something very specific. It has incredible longevity. When I get into over 50, then the longevity is closer to that 2-year mark before we really should think about doing a second round.
Okay.
But the interesting thing is the second round actually does more than the first round because there seems to be a building effect. The other is it does not preclude. The biggest misstatement I've heard around thread lifting is that it makes a facelift harder.
I was going to ask, is there any?
That is absolutely not true. Again, a huge experience doing them with a history of thread lifting.
Right.
It does not. In many ways, for my plastic surgery friends who are on this Instagram Live, it actually is analogous to a secondary facelift because you do get a deposition of collagen, which is your roadmap. You get your roadmap to where you're going. And so it does not make it harder at all. If anything, it actually makes it easier, in my opinion. Okay. So that's kind of, you know, how I put that piece together as well.
That has always been one of my lingering questions. So I'm glad we got to settle that. And so talking about the skincare piece, because I have been lucky enough to try a lot of skincare over the years. What I really appreciate about what you're doing is that it's all backed in the same clinical research that you back your procedures in and your surgical and non-surgical practice in. And so I'm curious kind of why that was so important to you to have the skincare component to what you offer.
Well, so and you and I touched on this a little bit when we met up in New York. For me, the big thing has always been to really go to the space where people in my profession maybe are not looking, that are curious. And for me, one of the areas has been skincare, and in particular looking at skincare in the arena of cannabidiol or CBD. Yep. And so having a practice in Los Angeles, looking at a variety of applications, creams that are used for any and everything from arthritis to, you know, upset stomach topically.
Yep.
It made me very curious about the lack of data or the lack of clinical research, really looking at how and why these things kind of happen or what the benefit is. I was convinced of the benefit because one of my LA patients was kind enough to give me a cream that's useful for back pain. I'd thrown my back out when I was out hiking and running. And so it really worked. It really, really worked. So then what I did is I decided, and with my skincare business partner, Alex Samirsky, what we did was, and he's based in California as well, we collaborated with our lab because I, as you know, have had a skincare business for the last 8 years, mainly focused on servicing my patients. But
Right.
because of the feedback, we've expanded, and ultimately, with that, this CBD related research, looking at CBD with retinol, and really tripped into something that is quite powerful, and I believe will be the roadmap for a new genre of skincare. And it's clinically tested. We published it in the Aesthetic Surgery Journal, open
Yep.
access, so anybody can have access to this data. And at the end of the day, it's amazing that it's some of the first research looking at outcomes for CBD, and as it relates to treating skin conditions, whether it be inflammatory, pro-aging related, and
Yep.
and what I'm really, really, really excited about is just the idea that my team, we get to be part of something that is new, that will be, I believe, groundbreaking, just like when I was doing the clinical research around hyaluronic acid fillers and skin of color. That was an area where nobody wanted to go at the time. And it was just for me that I'm a bit of a contrarian. I wanted to make sure that there was a carve out for the benefit of everybody, and the same is true for this. This actually opens the door to a new way of looking at skincare.
The Restylane story was just so incredible to me, that was something that you needed to even put your step forward to volunteer to lead, because again, it's incredible and important how far we've come. But what I think is really interesting about the clinicals that you've done on the CR emulsion is that, I mean, I saw the before and afters. The age range was expansive in terms of who this product can benefit. And then looking at different skin types, looking at different skin color, I mean, it really feels like it runs the gamut for you in terms of who you're looking for these products to benefit.
Absolutely. And I was just having a conversation with one of my favorite patients this morning, who has pretty significant rosacea. And her rosacea is already in less than 2 weeks, has already shown signs of improvement. Not that it's indicated for that, but it has clearly, and she's not the only one. And so you would never think that a retinol would have a positive effect on rosacea or anything remotely like it, but there's something about the dynamism, or really that nature of the CBD with the retinol, that does something that is dramatic. And so for me, it just, even in as little, because I was at our tipping point was 6 weeks in the clinical trial. I mean, it's unusual to have a skincare agent that in 6 weeks can show a clinically significant change.
Yeah.
And this is based on patient diary. All the patients were blinded to what they were using, other than they knew that cannabidiol was in the
Correct. Yeah.
But they weren't given a lot of feedback in terms of what it is that they were applying, other than the lotion that was being clinically followed. And we set no expectations as to what it should do. So for us, it made it a cleaner study.
Yep.
And really, at the end of the day, produced something that is significant. And I have another person who, again, came in. Today was my day of revelation. Somebody who came in who had pretty significant mask knee that was hormonally driven.
Okay.
And again, after a couple of weeks, it's nearly resolved completely.
Awesome.
And this particular person had tried just about everything.
Yep.
So we're really, really, really excited, but also excited because it gave us a platform to develop our really the videography assessment tool.
Yes.
Which is in its infancy. We're still working on it in terms of validating and putting it together, but at the end of the day, we're well on our way.
Do you hope that the video piece for you, are you going to kind of continue to explore that in other areas as well? And do you hope that becomes the norm beyond just what you are working on?
I do believe that's going to become the norm in many ways. I've started to see, other physicians who I respect start to incorporate video into their work in terms of showcasing their work.
Yep.
And I think that this is we're gonna see more and more of it as we move into the future. And frankly, it's so easy now compared to even 5 years ago. The video quality, getting a raw 4K video from a smartphone, it makes it really, really powerful. And you can control for lighting. I mean, most of us on the clinical side, we have a controlled lighting room.
Yep.
So it's just a matter of doing the same activity in a controlled fashion with controlled lighting. And we're just, like I said, it's in evolution. I believe more will come from this, and it's something that's exciting.
And I feel like, to bring the conversation full circle to your point about movement and kind of, you know, honoring that movement of the skin and kind of that natural nature of expression, video is an honest way to do that, because you can't trick it the way you can trick a 2D image.
1,000%. And I do think it will be the great equalizer for kind of a result. I mean, now, you know, there will be more and more of a demand for, you know, influencers and the like on social media to have videography versus a static picture. And so as that continues to evolve, you know, the standards are going to change with it. What you know, different people got away with just because they had a great 2D picture, you know, at the end of the day, that's not going to be good enough. And I do think, you know, the number one reason why people do not get filler, who have never had filler before, is because they're afraid of the look.
Yep.
And it's not safety, it's not that something bad is going to happen health-wise. It's that they're afraid of what the end result is going to look like. And I can't tell you how many people I see who will say, I do not want filler.
Yep.
And that's why we've seen a bump up in those wanting facelift, is because there's filler backlash.
Interesting. Okay.
So that's the key there.
Yeah. Nope. It all makes sense. And I'm so glad we got to have this conversation, and thank you so much for finding time in what I know is a very busy schedule. And everyone watching at home, thank you. If you missed any of this, we're going to be sharing it to our videos, so you'll be able to rewatch the whole thing. If you don't follow Dr. Few, you can at Julius Few MD, at the Few Institute, for a Beauty. Many ways to find him. And Dr. Few, this was such a treat. Thank you again.
Meg, it's a treat for me. You're such an expert and have been in this space, and I feel fortunate to have known you as long as I have.
Thank you so much. Have a great rest of your day, a great night, and thank you everybody for watching with us.
Thank you. Take care of yourself. Thanks, everybody. Good night.
Good night.